Welcome to The Explainer. Today, we are diving into one of the most severe drug crises in Canada, the explosion of methamphetamine in Winnipeg. And really, it's a story about economics, global logistics, and a public health emergency that's just spiraled out of control.
So let's just start with a number to set the scene. 406 kilograms. That's how much meth the police seized in a single bust at the Manitoba border in 2024. I mean, to give you an idea of what that looks like, that is the largest seizure of its kind ever on the Canadian prairies. It just hints at the massive scale of the supply that's flooding into the city.
And what's really telling is how that supply translates directly into human suffering. Look at this. Between 2013 and 2018, emergency room visits tied to meth just skyrocketed. We're talking a 1,700% increase. This isn't just a policing problem, This is a full-blown public health emergency, and it's completely overwhelming the city's hospitals.
So this incredible surge in both the supply of the drug and the harm it causes, well, it brings us to the big question for today. How did this happen? How did Winnipeg become the epicenter of this perfect storm? To really get that, we have to start by looking at the price tag.
You see, the engine that's really driving this whole crisis, it's not just about the chemistry of addiction. It's about plain, simple economics. Meth has become, by a long shot, the easiest and cheapest high you can get in the city.
Let's rewind the clock a bit, back to around 2009. Back then, a single gram of crystal meth was, it was a premium drug. It was pretty rare, and the price showed it. About $300. Yeah, this wasn't something just anyone was using.
Okay, now fast forward to today. That same gram, you can buy it for as little as $20. A single hit, what they call a point, goes for $5 or $10. For a high that can last half a day. Think about that for a second. It's cheaper than a six-pack of beer.
So what you're looking at here is basically a total market collapse. The price for everything, from a single dose all the way up to wholesale amounts, has just cratered. And this didn't just make it easier for people who were already using. It completely lowered the barrier to entry for thousands of new users. It pretty much democratized access to one of the most devastating drugs out there.
So the obvious question is, where is all this incredibly cheap meth coming from? Because let me tell you, the days of some guy cooking this up in a small local lab, those are long gone. We're talking about sophisticated international logistics now.
And this shows you the main route. They call it the BC pipeline. It all starts in these industrial-scale super labs run by Mexican cartels. From there, the meth gets moved up into British Columbia, where it's hidden inside totally legitimate cargo on commercial semi-trailers. Then, it's just a straight shot down the Trans-Canada Highway, right into Manitoba.
And in this story, Winnipeg's geography is also its curse. It sits right in the middle of the country, which makes it a perfect distribution hub. It's the ideal crossroads for criminal organizations to move product east and west across Canada and then down south into the U.S.
So when you have this nonstop flood of super cheap, really pure meth, you get a public health crisis. It's predictable, and honestly, it's tragic. The impact on the ground is just devastating, and the drug market itself is evolving in some really dangerous ways.
So let's talk about cheetah. It's a Punjabi word that means white. And this isn't just meth, it's a cocktail. It mixes the stimulant high of meth with a powerful opioid, usually fentanyl. And the twisted logic here is that dealers created it to get users from both the stimulant and opioid worlds hooked, creating this incredibly powerful cycle of dual dependency. And you can see the results of that mix right here, and they are absolutely lethal. By 2022, nearly 70% of all meth-related deaths in Manitoba also had an opioid involved. People are taking this dangerous speedball, often without even knowing exactly what's in it or how strong it is. For paramedics and ER doctors, this whole situation is a clinical nightmare, and here's why. An opioid overdose, on one hand, makes a person stop breathing. It requires one type of response. But meth toxicity, that causes extreme psychosis, paranoia, and agitation. It is a much more volatile, much more dangerous situation for first responders, and it takes way more hospital resources to handle, often tying up ER beds for days at a time.
So naturally, when you're facing a crisis this big, law enforcement has thrown everything they've got at it. The police have launched some of the most complex investigations the city has ever seen to try and take these trafficking networks down.
I mean, you look at these operations. Project Riverbank, Project E-Class, these were huge investigations that took down entire cells of that BC pipeline. They've gone after Hells Angels importers. They've seized hundreds of kilos of drugs, and they've put major traffickers away for a long time. On paper, these all look like massive victories.
But this
This is where we get to the central paradox of this whole crisis. If law enforcement is having this much success, seizing record amounts of meth and arresting high-level dealers, then why is the drug on the street cheaper, purer, and easier to get than ever before?
Well, researchers at the Manitoba Center for Health Policy have a really compelling answer. They've linked up all this data from healthcare, the justice system, and social services, and they argue that this isn't just an epidemic, it's what they call a syndemic. That means it's a bunch of different epidemics all happening at once and making each other worse. The drug use, they say, is really just a symptom of deeper problems, like poverty, trauma, and untreated mental illness.
So what does that actually mean? Well, it means the police are hitting the supply side, and hitting it hard. But they're not even touching the real reason people are using in the first place, the demand. For every single dealer they arrest, another one pops up to take their place. Why? Because the market, which is driven by people trying to escape their pain, is just massive and incredibly profitable.
And that leaves us with a final and really challenging question. The police response is obviously necessary, but all the data suggests it's just not enough. It makes you wonder, is this a problem that can be solved with handcuffs and prison cells? Or does the real solution lie somewhere else entirely, in healing the deep social wounds that are driving the demand in the first place?